Thank you for helping out with the ultrasound evaluation of non-displaced distal radius fractures research project. This project is a joint effort by Moore Orthopedics as well as the Department of Emergency Medicine. Our goal is to determine the sensitivity of ultrasound in detecting distal radius fractures. Any child who presents to the pediatric emergency department with distal radius pain is eligible to be considered for the study. We want to include all of those with wrist pain, especially those with tenderness over their growth plate. Those with normal x-rays are included because Salter-Harris type 1 injuries often have normal plain films. Exclusion criteria for the study include bilateral wrist pain, prior wrist fracture or surgery to either wrist, more than 24 hours since initial injury before seen in the emergency department, and displaced fractures greater than 3 millimeters or angled over 5 degrees. Any child that presents who is eligible for enrollment and does not meet exclusion criteria should prompt a call to one of the investigators in this study. Nick Daly is the first contact unless one of the ultrasound fellows is working, at which point they should be contacted. All investigators and their contact information is on a sheet next to the study box in the PEDS emergency department. This study is enrolling 24 hours a day, 7 days a week. The investigator will then come into the emergency department while the patient is there and complete the consent for inclusion in the study. The ED staff is responsible for their baseline excellent care. They will then also call the investigator. Once the investigator has consented the patient, a second or third year resident, ultrasound fellow, or ED attending will perform ultrasound of the distal radius. When performing the ultrasound, you must first make sure you have the ultrasound checklist in hand from the study folder. The ED team is responsible for completing this checklist while performing the ultrasound. It should only take a couple of minutes to complete the ultrasound and checklist. Make sure to include all information on the checklist. First, make sure to write the patient's information on the sheet or attach a patient sticker. Next, please put the name of the physician performing the ultrasound and their level of training. Once this is complete, push the patient button on the Sonosite machine and enter the patient's MRN into the patient ID field. Then enter DRF into the user field. After these two are complete, hit the Done button on the machine and your screen should look like this. Please make sure to only use the Sonosite machines with the large L38 linear transducer. You will then obtain 4 different videos of each wrist using the non-affected side as a control. Make sure to circle left or right corresponding to the injured side. The first view that you're going to get is the transverse dorsal view of the patient's distal forearm, as you can see here. Make sure to keep your probe perpendicular and drag it back and forth along the area of interest. The next view is the longitudinal dorsal view of the radius. Make sure the indicator is pointed proximally towards the patient's upper arm in this view. Also, make sure once again that you label your images. Next, obtain a longitudinal radial view of the patient's distal forearm. Make sure to roll the probe and adjust the angle to keep the bony cortex bright and white on your ultrasound screen. It's also important to adjust the depth to about 2 centimeters to give optimal viewing of the radius and to keep the epiphysis on the right 1/3 of the ultrasound machine screen. Finally, obtain a longitudinal volar view or palmar surface view of the patient's arm. Only do this view if manipulating the patient's arm will not cause significant pain to the patient. Now let's take a look at some of the abnormal findings that you'll see with ultrasound. First, here's a longitudinal view through a distal radius showing a fracture line with a small amount of fluid, demonstrated here with where the arrow is pointing. Next, here's a transverse view through the radius showing a small hematoma on affected versus unaffected side. In this transverse view, you notice the sharp step off where the fracture line is occurring. In this view, you can appreciate the subtle fracture line on the left side of the screen. However, you more definitively see the dark anechoic fluid surrounding the bony cortex. In this image, you can appreciate a longitudinal view through our tendon. You can also see the dark anechoic fluid surrounding the tendon, which can be present in a small, subtle fracture. Remember when you are completing these exams to call an investigator as soon as possible. Also, follow and complete your checklist very closely. Take your time with your scans to make sure you get the best images possible and complete your checklist when you're finished. At the end of your exam, make sure you hit the patient and the new end button on the ultrasound screen to make sure that these images are saved. Staple a copy of the consent to the checklist and put in the box. Also, make sure the patient goes home with a copy of their consent. The patient will leave with a copy of the consent in the More Orthopedics folder. Nick Daly's business card is on the front of the folder if they need to contact him. The patient will need follow-up with More Orthopedics within 24 to 72 hours. They can call the number on Nick's business card during business hours and identify themselves as a participant in the research study to ensure this appointment. Once all of the information is complete, staple the checklist to the copy of the consent form and place in the locked box in the PEDS Emergency Department Pod 4. Once again, thank you very much for your help and let us know if you have any questions.